Austin. I'm a medical oncologist at Consultants in Medical Oncology and Hematology. So when I was in medical school and you study all the different disciplines within medicine, it was the cancer patients that really motivated me. And I also really appreciated the close relationships that oncologists had with their patients, that they helped them through a really chaotic and difficult time in their lives, and our means of support and nurturing them through that process, and that appealed to me as well. CMOH is a patient-centered medical home, which means that we operate in a slightly different way than many other practices. We really have our patients at the center, and we have structures in place that allow us to provide excellent patient care, like same-day appointments. Patients are frequently added to our schedule to address acute needs that come up throughout the day. We have a triage nurse whose sole job is to field phone calls from patients and address them immediately, have them come into the office for additional supportive measures like fluids or other IV medications, with really a goal of providing the best care that we can for our patients, but also avoiding going to the emergency room or going to the hospital. So we really try to take care of those needs as quickly as possible when they arise, so they don't become a more complicated medical issue that requires hospitalization. And so by doing that, I think we take better care of our patients. I think that we can meet those needs quickly and effectively through the infrastructure that we have in place here. I'm really impressed by the way that patients are able to go through their cancer treatments with the grace and the dignity with which they approach their treatment, and the struggles that they are facing. When someone is diagnosed with cancer, it's like a bomb has exploded in their lives, and there's a tremendous amount of chaos and uncertainty. And to see people be able to move through that and get through treatment and improve afterwards is really very inspiring. I'm really impressed with the courage and the strength that our patients have and show us through their treatment. So in taking care of patients, I believe in shared decision making. I think that my role is to provide all of the medical information that the patient needs to make the best decision for themselves. Medical care is not a one-size-fits-all, especially when you come to cancer care. There's a lot of different treatments and different therapies, and I think it's really important to tailor those treatments and therapies to the patient. And part of that is understanding what the patient wants and what the patient needs, understanding what motivates them and what their goals are. And so by providing what I consider to be shared decision-making, I explain the different treatment options to the patient, say which ones I would recommend, but then really want to hear from the patient and what their goals and desires are, so that we can come to an appropriate treatment together. I believe in providing truly excellent cancer care in a community setting. I think that you can provide first-class evidence-based medicine in a community setting, and I think that we do that here at CMOH. One of the advantages to getting treated in the community is that you're treated at smaller treatment centers. The care, I believe, is more personalized. You get to know the staff, you get to know all of the secretaries and the nurses, as well as your physician well, and you get to see your physician at every visit, which is different than a lot of the larger centers. So I think that it's very important for women to take an active role in their breast health. The most important thing is getting your mammogram. Getting a mammogram every year, being on time for getting your mammogram. I think it's also important to do periodic breast exams, and if you notice something that's different, to let your primary care doctor or your gynecologist know and get that addressed immediately. I think it's also important to be aware of what your family history is, that some people, based on their family history, could be at increased risk, and to really pay attention to that. Those people may want to be particularly vigilant about being on time with their screening mammograms, and looking for their providers to see if there's any additional screening or testing that they should have done.